We have a very diverse and unique group of residents that are passionate about patient care, passionate about teaching one another. There's great camaraderie and culture among all the residents to be able to bring in all sorts of different people from around the country, make them feel welcome, and create an environment that is conducive to this type of learning.
When I came here, one thing that struck me was the sense of camaraderie, and to put it simply, friendship. The culture here was very welcoming. This place has a great hybrid of sort of rigor and a dedication to excellence, but also a sort of a more laid back, casual, welcoming, inviting atmosphere.
At the university, we get a lot of really complex post-surgical, post-transplant cases, as well as a lot of oncology cases. We have a huge cancer center here. The university is the only academic center for hundreds of miles, so we have a huge catchment area. So you're going to see anything that could possibly happen to the human body here.
Touring here as a diagnostic radiology applicant, one thing that really stood out to me was the collegiality and consultations between the attendings in the main reading room. Really fosters that academic conversation and in-person consultation that you otherwise might not have.
From an educational perspective, a training perspective, I always say that one of the biggest strengths of this program is really the diversity of styles, whether that's teaching style, but also what they themselves have learned, both on the DR side and the IR side. There is an astonishing amount of variety that you can see. You don't always get exposed to that in a single training program.
The medical campus here is the tertiary referral center for the whole Rocky Mountain region. The Anschutz Medical Campus is where everything is sort of housed. So when you are in the reading room, you're only steps away from the procedural CT room. You're only a quick elevator ride from the IR procedural suite and just a quick walk down from the clinics. And so on any given day, you could participate in any number of those things.
It was really important for me to have a program that had a lot of patient variety in terms of the types of patients that come in, places with trauma center, transplant center, a major cancer center, and pediatric center that would train you up in all different sorts of patient populations and different pathologies that I wanted to feel like when I was leaving residency that I was ready to practice anywhere. And University of Colorado definitely had that when I was looking around at programs.
We try and create a program that gives you every single opportunity from the type of people you treat, the type of diseases that you see, the technologies that you'll experience, and then to be able to have some graduated independence as you move throughout your training so that by the time you get out into the real world, it's not your first day having had that degree of independence.
One of the unique things of this program is that you're not only going to get excellent training, both in the diagnostic departments, but also in the interventional suites, but you're also going to get training outside of just radiology. And then if you have a passion here, you can meet it with opportunity. The department is very receptive to new resident-led initiatives. For example, the global health track that I'm leading, where people were involved in helping underserved communities. So that is very unique because we're advancing radiology, not only here at the University of Colorado, but we're advancing radiology elsewhere. And the department is supporting that to be a reality.
Instead of training just good radiologists, we want to train really good leaders in the field as well. These opportunities allow residents to have a specific distinction in whatever area of radiology they're interested in addition to the normal clinical education that we provide.
The choice of residency is 4 years of your life. What kind of people do you want to be around? Where do you want to live? What do you want the culture of that place to be? And this place not only will offer the opportunities after residency to get the jobs you want, to get the career you want, but you're going to spend 4 years in Denver, Colorado in an amazing place. And you're going to look back on that time and be very happy that you did that.
We come out of this program very strong clinically, whether that's diagnostic or interventional. We get a lot of experience here, and that can help with the confidence and kind of going out into the great wide world after this.
There are a lot of really great programs out there, but we just have so much to offer, both academically as a program and in terms of life experience living here.
As a trainee, it is certainly a balance. You want to, be exposed to enough and work enough to where you feel confident without feeling, overwhelmed and burnt out at work. And I think we strike a great balance for that. It's important to be in a place that you're going to be happy living. And I think we have a pretty complete package as far as training experiences, networking for future jobs, and living in a great environment.
So important to remember that at the center of everything that we do is patients and optimal patient care. And it's so important to have that drive every part of what you do. I think that residents here really just want to gain an incredible educational experience that is collaborative, that's supportive, and that allows them to really be themselves.
At the University of Colorado, our radiology department, located in the breathtaking Rocky Mountains, stands as a beacon of innovation. Our shared mission is to deliver exceptional patient care, advance medical knowledge, and foster diversity, equity, and inclusion. At the heart of our mission lies the residency program, our top priority. It not only forges exceptional radiologists, but also nurtures the future of our department. Our dedication extends beyond training, and we actively pursue the retention of our graduates as faculty who are highly sought after, ensuring a legacy of excellence and providing them with gratifying job prospects post-training. Join us in this remarkable journey where we shape the future of medical imaging at this place we're proud to call our department.